Hi friends, good morning. This is Dr. Manish Mahajan, consultant neurologist from Gurgaon again. This morning of 3rd May 2022. A very happy Akshaya Tritiya to everyone. Happy Eid Mubarak to all of you. On this auspicious day, we'll continue with our discussion on multiple sclerosis. And I'm maintaining the walking as part of the mission My Health, My Responsibility and the HDR 100-day walk run challenge. Now coming back to multiple sclerosis, so we have already discussed what causes multiple sclerosis, like what it exactly means, that it's a chronic inflammatory demyelinating disorder of central nervous system. To get the details, please go back to my first video. Then the second episode was on these common symptoms of multiple sclerosis, and today we will discuss how to diagnose multiple sclerosis. Now, once you get a common symptoms like optic neuritis, any weakness of one side, balance issues, the weakness of both the lower limbs, or you have loss of sensation, what we actually mean by when someone says that we have numbness of one limb or one-sided limbs, or it could be abnormal extra sensation, what we call as paresthesias. Now this is something that's obviously the person comes with a symptom to a doctor. Now if these symptoms they happen in a young person, that means commonly between the age of 20 to 40 years, and we are able to either establish that there is a dissemination in time and space. What does that mean? So if there have been two or more symptoms, maybe involving one side or different sides, at least 1 month apart, then this is dissemination in time. Now obviously if one side is involved and then another side gets involved, that says for dissemination for in space. Now why I'm mentioning this is because obviously the symptom will appear as per the involvement of the central nervous system. Is it optic nerve involvement for any particular area of the brain, or it is spinal cord involvement. Now once you have these symptoms, your neurologist will definitely do some tests. Now what are those tests? Those include some blood tests to rule out some very close disorders which can cause the disease in a similar manner, but they are different. Why they are different we'll discuss later on. And obviously first and foremost is the investigation is the brain MRI along with the spinal cord MRI with contrast. Now even many disorders can look like the same multiple sclerosis even on MRI. So they are very close mimics. But there are certain characteristics which favor, and there are certain sites in the brain which are very much indicative of multiple sclerosis. And the pattern of involvement on the spinal cord again. So your neurologist is the one who will basically evaluate the brain spinal cord imaging. They will do some eye tests. As I yesterday mentioned also, that your eye doctor will not be able to see any abnormality in the eye. So there is one investigation which we call as visual evoked potentials. So that is basically done to evaluate and to establish the involvement of the eye nerve, that is the optic nerve, and to establish the diagnosis of retrobulbar optic neuritis. In long-term cases or long-standing cases, another test which we can help is the OCT that is done in the ophthalmology department usually. And visual fields will establish the type of involvement in the diminution of vision, as the predominant type of visual loss is the central component of the visual field. Now, all said and done, by the blood test, MRIs, these ancillary testing like visual evoked potentials, OCTs, then one will like to do certain examination on your CSF, that is the cerebrospinal fluid. It's a fluid which circulates around the brain and the spinal cord, and will show something which is called as the oligoclonal bands. Now, why this is important? Because in many cases when they present with the first symptom, which we say that it is a clinically isolated syndrome, and the MRI brain also doesn't show the staging, or that is there is a dissemination in time. As per the recent guidelines, oligoclonal bands can be used as a marker for dissemination in time. So all these combined together, that means most importantly, the diagnosis of multiple sclerosis is a diagnosis of exclusion. That means in a classical syndrome where we discussed like optic neuritis, imbalance while walking, or limb incoordination, any numbness of one particular limb, spasticity, tonic spasms, all these symptoms, if they are happening in a young person usually, and the MRI is very indicative, they are falling into the criteria of multiple sclerosis, one can definitely have. After ruling out, other mimics can establish the diagnosis of multiple sclerosis. So unfortunately there is no test which can say that yes, this is multiple sclerosis. So this is how you establish the diagnosis of multiple sclerosis. So goodbye for today, and then we'll follow up with how to manage multiple sclerosis. So we'll discuss about the different treatment modalities. Okay, goodbye, have a nice day, bye bye.